Perfect. Alrighty. Well, welcome everybody to this month's edition of Hump Day Health. My name, if I haven't met you before, my name's Amy Rendell. I use she, her pronouns. I am a Health Promotion and Workforce Development Officer here at WAAC. We're based here in West Perth. We'd like to start off by acknowledging the traditional owners of the lands that we're all calling in from today. Today I am joining you from the traditional lands of the Whadjuk people of the Noongar Nation. It's a privilege and very fortunate to be able to work and do the work that we do on these lands, and acknowledging that these are stolen lands that we are meeting on. And pay our respects to elders past and present, and extend those respects to the traditional owners of the lands that you may be calling in from today across the state, and also to any First Nations people joining us today. So very quickly going to do a bit of an overview of the session. So we'll start off by doing a brief overview of PrEP. For some of you, this may be kind of a refresher of PrEP, maybe a bit of an update. Maybe you're coming to this not knowing much about PrEP as well. So hopefully this will have something a little bit for everybody, noting what stage of knowledge or understanding you're at. So we'll do a bit of overview of PrEP and current usage of PrEP in Australia. We'll then look at around how PrEP is accessed, what might be some barriers and enablers for people accessing PrEP. And then we're going to look at touch on the PrEP shortage, which is something that has occurred very recently, which you may have seen updates on, but we've got some kind of actionable points or ways that you can respond to any questions you might have around the PrEP shortage or any concerns people might present regarding the PrEP shortage. And then we're going to look at some kind of what's kind of in the pipeline for PrEP and the different forms of PrEP and kind of methods of dosaging, but also people accessing PrEP as well. So we'll look at what's kind of in the pipeline, what's happening around the world within the scope of PrEP. So I'll just get into it now. So again, housekeeping as well. So for those who weren't on before, this session is being recorded for people to watch back. We had some people that weren't able to attend today. So just ask if everyone could keep their microphones off just for the session for a little bit today. If you have any questions, welcome to pop them in the chat. And we'll have time at the end where we can have some discussions and some chats as well. We can all put our cameras and microphones on then if we would like to. But let's begin. So I'll start with a bit of an overview of PrEP. So I think that image may be a little bit blurry there. So I guess what is PrEP? So PrEP, we're talking about pre-exposure prophylaxis for HIV. So this is a form of prevention for people who aren't living with HIV. So a big important part there is that it is for people to taking it if they aren't currently living with HIV. And it's taken before potential exposure. So you may have heard of PEP, so post-exposure prophylaxis. So that is what's taken after potential exposure, up to 72 hours after an exposure event. This is taken prior to any potential exposure. So in terms of the effectiveness, it has been shown to be highly effective in preventing HIV acquisition. So for receptive anal sex, it is 99% effective for preventing HIV transmission. Got their receptive anal sex as when looking at different sexual activity, that is sexual activity with the highest or deemed with the higher risk of HIV acquisition or transmission. So also for other sexual activity as well, that it has that greatly reduces the risk of transmission. It doesn't prevent other STIs and blood-borne viruses. So when we talk about PrEP, we do an education sessions, whether we're talking to community or talking to clients. It's important to reiterate that while it is very effective at preventing HIV, it doesn't prevent against other STIs and blood-borne viruses, so that it's not recommended necessarily to be the only means of protection against any different infections, and that there will be some other kind of considerations as well, whether it's around condom usage or injecting practices as well, to preventing these other kinds of infections as well. So what it consists of is a combination of two ART medications. So ART is for those of you who don't know or want a bit of a refresher, it is the therapies available for the management of HIV. So it has a co-formulation of two different drugs, and it there's only one particular co-formulation that we have there that's licensed for usage in Australia as PrEP. So how it's actually taken, just turn my line up, it's kind of a bit noisy for me here. So there's two ways that it is currently prescribed in Australia. This is from the ASHM guidelines. So if you're wanting to know more about the specifics, kind of ins and outs, we'll give you kind of a brief overview today. But if you have any more kind of specific queries or want to know a little bit more in depth, really recommend checking out the ASHM guidelines, particularly around prescribing PrEP and considerations for prescribing PrEP. So the most common way that PrEP can be prescribed is through daily PrEP, or kind of standard way. So what this requires is taking 1 tablet daily, and this is recommended quite frequently for most people. And been shown to have that same effectiveness. There's another type of dosaging called on-demand PrEP, or sometimes known as 211, or event-based PrEP as well. And essentially what this is kind of having a small lead-in time for a dosage of PrEP. So taking 2 tablets between 2 to 24 hours before potential exposure, and then taking 1 tablet 24 hours after, and then another tablet 48 hours after that as well. So you can see a little timeline here. And what this is kind of doing, maybe if somebody is maybe traveling for an event or attending an event, or kind of is able to kind of preempt when they may have potential exposure, when they might be having sex, whatever it might be, that they are able to plan ahead. This may be an option. It is only clinically recommended or been approved for or recommended to prescribe for cisgender men who have sex with men. The reason for this is that's where most of the evidence is or the evidence is to be able to say that it is effective. In order for them to approve it. Amongst other populations, there may not necessarily be as much evidence to be able to support that it is effective across the board. So currently it's only recommended for cisgender men who have sex with men. Everybody else, daily PrEP can be recommended. So we're looking at the usage of PrEP in Australia. So this data is from the Kirby Institute. So they release reports, I believe it's every year. There's periodic reports of PrEP usage in Australia across the board, and look at the different demographics of who has been using PrEP since it was being available on the PBS. So the current usage, so between 1st of April 2018 and the 31st of December 2023. Someone's got a hand up there. Yes, Pauline? Do you have a question there?
Sorry, Amy, are you displaying something on the TV, on the screen?
Yes.
It's got can't display content. There was a problem displaying the content. I can't see what you're talking about.
Oh, yes. Sorry, I will do my best to fix that one now. Thanks for bringing that up, Pauline. Has anyone else got that issue there as well too? I can try a different way of sharing my screen. I'm about to do this. So how do we stop sharing this? Okay, let me try something.
See the presentation on my computer.
Okay.
Where I was. So.
Right, let me try something else. This might help. Here. Go. So if we share this, let's close all my tabs. Are we able to see the screen a lot bit better here if I share the slides this way?
No, I still can't see anything.
Still can't see it. Okay, Pauline, I'm not sure why that might be. I can send the slides through to you afterwards if that would be helpful for you as well, to be able to see the kind of the stats. The most of it will be, I'll be talking it through it today, but I can happy just to send it through with the notes if that would be helpful for you. If there's not sure what else I could do to help.
Not a problem. That'll be fine. Thanks.
Well, thanks, Pauline. So sorry about that. Technology. Okay, so I'll get back to sharing this one. So looking at the current usage of PrEP. So about 74,597 people were dispensed PBS subsidised PrEP at least once. So this may have been that they've prescribed it once and ceased taking it, or they may have been prescribed at multiple occasions. So these are looking at the individual people that have been prescribed PrEP in Australia in this period. When we're breaking this down, the Breaking it down by sex, you can see there's quite a big disparity between so people that identified in this data as being male and identifying as not being male, that 97.5% of people prescribed PrEP were male. And when we break it down by age demographics there as well, 38% of these people were 25 to 34, so quite a large prevalence there in that area of people using PrEP, and then also 24% in that 35 to 44 age bracket. And then amongst the other age brackets, there was still a higher number there, but the real predominant area there was that 25 to 44-year-olds. Let's make sure I can get my other notes up there. So when we are talking about, so 2 moments there, I just now lost my notes. What's going on? Sorry, everybody, 2 seconds. Just trying to. I'm on a different computer as well, so I'm just trying to. Oh my gosh, my mouse is gone missing now. Oh, it is a good day for technology today, isn't it? Let's go presenting this here. And then perfect. Okay. Here we are. So when we comes to the usage of it, there's also a study that was done looking at the discontinuation of using PrEP. So people that were prescribed PrEP, but then for whatever reasons it might have been, are no longer using it or have had kind of periodic usage of it. And when they compared it, obviously there are different reasons why people may cease using PrEP. Maybe there was only a period of time where they either deemed themselves or their prescriber may have deemed that there was a risk of acquiring HIV and that there was a recommendation to be using PrEP in that time period. But when comparing the different the data looking at why people had ceased using PrEP, there was some trends really kind of arose in this. And the people most likely to discontinue using PrEP were younger people. So more so kind of looking at that lower demographics here, maybe 24 and under and younger again, and then also women as well. And then looking at independent predictors of discontinuation were being female sex, being prescribed or seeing prescribers that were in an area with a low estimated prevalence or population of people who are gay, and within the prescriber location, and also low prescriber PrEP caseload. So clinicians that maybe don't have as much experience prescribing PrEP or managing PrEP usage over a long period of time, many different factors there, but there's really those kind of independent predictors when discontinuing PrEP. There's been a bit of research that's been coming out that Catherine McPhail and colleagues have been looking into PrEP usage in Australia and Australian women. And there's been a couple of studies that were done both with providers and also women who use PrEP about their experiences in the process of prescribing PrEP. There's some interesting kind of barriers were identified by the prescribers or by the providers. One was about a women's knowledge about PrEP, so knowledge of PrEP availability, knowledge about their own eligibility, and really that kind of general lack of awareness around PrEP. Firstly, if we look at the women's experiences of accessing PrEP, again, it comes back to that limited knowledge about PrEP and PrEP availability for women. Knowledge tended to be higher among women who were connected to the queer community, so whether they be friends and family, being members of the queer community themselves. And often PrEP access and information is often facilitated by men. So whether it being linked into services or being recommended PrEP by a male partner, or male peers, that kind of facilitation of accessing PrEP was done through men. So when it came to looking at the providers, when they're assessing risk or eligibility to prescribe PrEP or willingness to prescribe PrEP to a patient, they acknowledged that there really was a lack of targeted information for providers around providing PrEP for women. They often had an assumption that a woman's risk was quite low, so their threshold for assessing risk for women was much higher than it may have been for a male or another person accessing the services to access PrEP. And there's also discussions around, in terms of the actual access to healthcare and PrEP providers, maybe specialised PrEP providers. So PrEP can be prescribed by any doctor, but when accessing services, maybe sexual health services or health services maybe have a specific focus around HIV, a lot of these services may have been quite difficult for a woman to be able to access. There may be services specifically for men who have sex with men, around, and that also kind of opens up a more broader general question as well around women's access to sexual health and sexual health services specifically for women. And the last point I'll bring up as well is the discussions around healthcare providers actually initiating conversations. So we were acknowledging whilst they themselves are quite knowledgeable about PrEP, they knew to ask for it. And that definitely isn't the case for every person. If we look at people's knowledge around PrEP, we could look at the targeted messaging for PrEP since it was first available in Australia. A lot of messaging has been targeted or has been focused towards men who have sex with men and those communities. And so that's kind of messaging, that knowledge hasn't more broadly been dispersed necessarily amongst a broader community. So, and if doctors aren't bringing it up, if patients aren't aware of it, they're not going to be asking for it or inquiring about it. So, kind of looking at more at trying to have a system that sets up to inform people as opposed to it being kind of driven by the patient and motivated by their own knowledge. So with accessing PrEP, so PrEP is a Schedule 85 drug. So any doctor can prescribe it, can provide a prescription for PrEP. Unlike ART, so that's used for the treatment of HIV, which is an S100 drug, so only specialised providers can provide this. PrEP can be provided by any doctor, any clinician. When it comes to costs, there are different kind of considerations for costs of PrEP. So it is under the PBS, so the Pharmaceuticals Benefit Scheme within Australia. And so this requires Medicare card to be able to access or Medicare eligibility to access. And so requires a PrEP prescription and then is available at full cost at $31.60 per month. But with a concession card, that can be $7.70 per month. It's also available under the Closing the Gap scheme. And there is other means of accessing it also through PrEP Smart and Healthy. So again, these do require PrEP prescription and often with a Medicare card. When somebody is ineligible for Medicare, there are still options when it comes to accessing PrEP. They do still require a PrEP prescription, but they can access PrEP through the Personal Importation Scheme. So this is set up under the TGA, so the Therapeutic Goods Administration within Australia. And so people are able to import PrEP from overseas or from overseas providers. And often this can be at a cheaper cost than what it would be for them to access it here without it being under the PBS. But it still does require that PrEP prescription. PrEP is also available for free to people on low income or experiencing financial hardship. And so there are some different programs that people can apply for coupons. So that can be done through the M Clinic, which is facilitated via Green Cross Pharmacy. And then also PrEP Access Now, which I'll be talking about in a little bit. They've also got their own coupon program as well for people to be able to apply it to access PrEP for free. So look, this is around we're talking about the eligibility for all the kind of costs around actually purchasing PrEP. Looking at all of these considerations, a person still does require that PrEP prescription. And so there is also that consideration around costs of services and actually being able to gain the prescription in the first place. So whether or not there is access to services that are affordable, bulk billing, or there are affordable options if they aren't Medicare eligible. But then also looking at the additional costs that may be involved when going and seeing a clinician. So we'll look briefly at the eligibility for PrEP. So this is taken from or kind of adapted from the ASHM guidelines. So that's the clinical guidelines in prescribing PrEP. It's really again one-stop shop for if you are if you're a prescriber yourself or looking for some more information as well. But talking about PrEP and eligibility for PrEP, really recommend going there as a first kind of point for that. But it's important to point out that this isn't an exhaustive list of eligibility criteria, and risk factors really should be assessed. They are different for individuals and should be assessed on an individual basis when people are accessing care, like all other healthcare as well. So Initially, so the kind of guidelines around prescribing PrEP and eligibility for PrEP have changed in the last few years. So in 2019, the guidelines no longer classified a person's risk of acquiring HIV as being high or low, and no longer required that a person demonstrate that there was a risk of HIV transmission for themselves in the previous 3 months. ASHM also do explicitly state that the suitability criteria that they have for prescribing PrEP is not intended to limit or deny access to PrEP for anybody who's seeking it. So these are a guidance on where it should be possibly recommended, or if somebody, whether it's through assessing behaviours or assessing for other risks as well in general healthcare. But if somebody is seeking PrEP, and we'll go through these points here as well, these points are quite broad and intentionally can be quite broad as well, but these aren't designed to limit somebody's access to and a reason to turn somebody away for that. So possible risk factors, we're looking here at the kind of future risk indicators. So on the ASHM guidelines, they do have for the different populations, they have got both previous previous possible exposure as a risk indicator, but then also possible future risks in the future in the next 3 months that may be an indication for being eligible or suitable for PrEP. So looking at condomless sex with casual partners or sharing injecting equipment in the following settings. So overseas travel, particularly in high prevalence regions, with history of intermittent alcohol and other drug behaviours coinciding with an increased risk of HIV acquisition. So maybe engaging in something like chemsex. Recently left a monogamous relationship, engaging in condomless sex, or possibly entering or leaving institutional or correctional facilities as well. So applicable for both their condom sex with casual partners in these settings or sharing injecting equipment in these settings. Other eligibility risks could be having sex with people who you may think engage in these high risk behaviours as stipulated above. In HIV serodiscordant couples, so what we're talking about there is where one person is living with HIV, the other person is HIV negative. Many reasons for this, and this could be even with the understanding of one person being being virally suppressed, and knowing about U equals U and the messaging around the much lower risk of transmitting HIV, there may still be anxiety around transmission between the two people in the couple, or it may be also engaging in condomless sex in efforts to conceive. Many different reasons within this. This is again not a limited kind of list of reasons there why HIV serodiscordant couples, a person may be wanting to access PrEP, but it could also be around the education around U equals U, maybe assessing if it's maybe, why they might be experiencing this anxiety, but still offering PrEP as an option. And then also looking at when a person reports being so anxious about HIV infection that it may prevent them from having regular HIV testing or engaging in any form of sex as well. So you can see there that, again, they can be quite broad, and yes, that is quite intentional in some sense, would be quite intentional in some senses. So really kind of this is, again, a guidance, but not necessarily that somebody needs to fit into every single one of these boxes or exactly tick a box to be eligible to access PrEP. So we'll get on to looking at the PrEP shortage now. So the PrEP shortage, so Australia is currently experiencing a shortage or supply shortage of the medications containing, you have to forgive me here, my pronunciations are terrible, so tenofovir and emtricitabine. And I have a biomedical science background. I used to be a whiz at these ones, but now it's just, I can't get these pronunciations that right anymore. So these are the different drugs that are used in the co-formulations for PrEP medication that's used in Australia. So it's expected to resolve later this year. Currently, what the impact is looking like is people with a valid script may be only able to purchase one bottle at a time. Some people may, when accessing PrEP or when buying PrEP from their pharmacies, may like to buy in bulk, maybe 3 months worth. It may be that they can only purchase one bottle at a time containing 1 month's dosage. Some people may need to wait a couple of days for a supply of medications to arrive at their local pharmacy, so may require a bit of planning ahead. And it may also be that in some pharmacies they may not have any stock. They may need to travel to alternative pharmacies to purchase. So it may be wise to call ahead, possibly to check for for the stock that they have at those pharmacies, and to make sure that it's not kind of going to a bunch of different ones and having to follow it up and chase it up. So with this, we like to kind of, so these are some from the ASHM media statement that they put out, and I've also got some other points as well on how we can address this when talking to people about PrEP shortage. So both for patients accessing PrEP or community members talking about PrEP, it's important to make people aware of the shortage. So in case they might be going and accessing it at the pharmacy and wondering why they're only able to get 1 month, and so it's not also they're not kind of caught by surprise with that. It's really important to reassure patients that it is expected to resolve, and PrEP is still accessible, and they still should be able to access it, like whether online or in pharmacies. It just may not be able to access a larger volume of PrEP, or they may need to be more strategic about where they go to access it. Maybe it may be beneficial to discuss alternative ways of staying protected against HIV during the shortage. So whether this be looking at if it is suitable, if the person is recommended that the person is fitted for using on-demand PrEP. So changing to that 2-1-1 scheduling, so they're not taking daily PrEP and using a lower volume of pills if that is suitable for them. Also encouraging condom usage and other forms of prevention as well. So condom usage and preventing HIV. And then with doing this as well, because so when accessing PrEP and then through getting a prescription, they do require the regular screening for HIV and other STIs, bloodborne viruses. So when people may not be engaging with the healthcare providers as regularly to be gaining prescriptions, it's still encouraging people to maintain their regular testing schedule. So whether it's every 3 months, every 6 months, however often they're going and seeing their healthcare provider, if this is impacting their willingness to go see or their kind of motivation to go and see a healthcare provider, still encouraging them to maintain that regular HIV testing scheduling and that regular contact with healthcare providers. Some other tips as well, so looking on the screen here, if somebody has just so this is actually from PrEP Access Now, the tips that they've got on their website for the PrEP shortage. If somebody has just refilled, so say that someone's just picked up their 3-month supply, there's no need to do anything. They expect more stock to be available in the coming months. So not rushing out and thinking I need to fill the rest of my script and kind of stockpile it, because all that's doing is kind of creating more pressure on the system as well. So if you're able to put people at ease, knowing that if you've got your 3-month supply, it should be by the time you need to access your next script or fill your next script next, it should be up all sorted or be much more accessible at that point. If somebody does need to fill their prescription, they may only get a 30-day supply instead of a 90-day supply that they may usually get. And this is really just making sure that everyone is able to get PrEP with this low volume of PrEP coming into the market. So contacting pharmacists, checking the stock levels beforehand, asking if they'll have enough when they need to refill, and it may require kind of knowing that maybe you're getting quite low on your current stock of it at home, planning ahead and not kind of waiting until the last day to go in. I mean, I do this with my own prescriptions sometimes. It's only until like the last day or two that you go, oh my gosh, I need to go fill my script. Maybe planning ahead as well in case you do need to travel to another pharmacy or needing to wait for stock to arrive at a pharmacy. So if possible, call your pharmacy before going, especially if it's a bit of a trip. And if your pharmacy doesn't have it in stock, no need to panic. There will be other pharmacies that have it. Otherwise, there can also be PrEP accessed online as well. Well, lastly, we'll just look at where to next. So kind of the exciting kind of innovations of what's going on in the PrEP space. So you may have heard the talk about injectable PrEP. So this is using a similar concept to the same kind of concept as the long-acting injectable ART. So this one is a long-acting injections of cabotegravir. So in the usage as PrEP. So it's 2 monthly intramuscular injections, usually into the buttocks area. It has been approved by the TGA, so it was approved back in 2022 off the top of my head, but it's currently not on the PBS, so it's not currently available, but it is hopefully, fingers crossed, in the works. Very similar to ART, if you're familiar with the long-acting injectable ART, what it is they have received the initial injection, so after getting the tests and everything clear, ensuring that the person is HIV negative, testing renal function, liver function, the other tests that are done prior to prescribing PrEP. Person receives their injection, 1 month later receives the next injection. And then after this kind of monthly lead-in period, then they'll move to every 2 months. So then we're only having to take every 2 months, not having to rely on remembering to take a pill every single day. Another one as well that is in the works and is more kind of being looked at in other parts around the world. You've got the dapivirine vaginal ring, or the DAPI ring, much easier to say. So very similar concept to the vaginal ring that is used for contraception. So what it does is it prevents, so stops HIV from entering the cells in the vagina and stopping HIV from entering the body. So it's a ring that can stay in place for up to a month. And it secretes out dapivirine, which is a medication that can be used as PrEP in this instance. It stays in the body for anyway up to 1 month. And the effectiveness of it, because it is still being looked into, isn't as widely used. The risk kind of as protective factors does range depending on what source you look at, anywhere between 35% to 75% risk reduction when it comes to acquiring HIV. It's not approved for usage in Australia. It's not available in Australia from what I could find, but it is being trialled and looked at in, I believe, in several African countries. They are looking at this as an alternative to daily medication. Important to notice as well, to note as well that it is for protection for HIV acquisition through vaginal sex, and I believe it says it won't be effective or not seen out or being researched to be effective through transmission through anal sex. Last one I'll touch on is injectable lenacapavir. So lenacapavir is kind of a novel drug, but it's been looked into that is a capsid inhibitor. So it's different to the other types of ART medications available. And so it has a very different mode of action. So just check, I think someone may have just come into the chat. Yeah, there we are. So different mode of action. So it's being looked at is different uses as ART as well as PrEP. So what this would look like would be an injection every 6 months. So it's subcutaneous and it's done through the abdomen. And it's been proven for the first kind of rounds of clinical trials that they've been doing. The actual first big rounds of clinical trials they've been doing is as a part of the PURPOSE study through Gilead. It was I believe the first trial, or the phase, or the second phase was done only amongst women, and it's been shown to be highly effective. And there you can find the results and everything if you look into the PURPOSE trials and project a bit further. It's been very highly effective as means of preventing HIV acquisition. So it is still in this clinical trial phase, so it isn't yet available. But hopefully, as the phases go through, I think there's 5 phases they're looking at with this trial, and hopefully in the next few years we might hear a bit more about this and hopefully it become available as well. So yeah, so basically get excited. There's hopefully a bit going on in the PrEP world. Just lastly, going to touch on some places, some good sources of information, referrals, I guess kind of one-stop shop around PrEP usage and PrEP access in Australia. Recommend going to PrEP Access Now, or PAN. So it's really a one-stop shop here around PrEP information for clients or people looking to get PrEP. Actually getting PrEP, so accessing PrEP around the costs, where to access PrEP, service referrals, and all the kind of information around what it will happen and what will be required of them in an appointment, and what they're required to do in order to access actually starting to take PrEP. And similarly around using PrEP, they've also got PrEP for doctors, so some information for clinicians prescribing PrEP, and also referrals that they can provide to patients. They've also got some cute merch too, but they've got so a lot of the information I was talking about today, particularly the community messaging, a lot of it does come from PrEP, so PAN, so PrEP Access Now. This is what I was talking about earlier with ASHM, so they have their National PrEP Guidelines website, and it really has a really comprehensive overview of the different guidelines when looking at prescribing PrEP. PrEP usages, PrEP dosages, considerations for different populations as well, and as well as resources both for clinicians and also for patients accessing PrEP. So they have also got a referral letter that a patient can print out, that you could provide a patient if they were, or a person, say if you're doing any kind of community education, providing that to somebody that they can take to their doctor and have an explanation of what the doctor needs to do in order to be able to provide PrEP. So kind of removing that barrier for that maybe that patient-initiated conversation. It's written down there as a support for them, so that hopefully make it more likely that they'll be able to access PrEP, or their doctor would be willing to prescribe PrEP to them. And lastly as well, we've got Get Prepped as well. So this site is more, information is tailored a bit more for MSM or GP MSM, and but really has really great resources, but also really breaks down really comprehensively, looking at accessing PrEP, what is PrEP, and ways to prevent, other ways of preventing HIV as well. A lot of these sites are also available to translate. I don't know if you can see it here on the PAN website. These are screenshots of their home pages. They are available to be translated into other languages as well, which is really awesome. But that is the end of the formal presentation for today. I will stop sharing in a moment. I will pop in the chat the evaluation form that I would really love if you'd be able to provide any feedback from the session today. But I'll stop recording now, and welcome to turn your cameras on. Any questions you have, happy to have a chat now.